Hi, Al. Can you hear me? Are you talking? Because I don't hear you. Oh, you're on mute. Okay. So let me share my screen. Yes, thank you. I'm going to share my screen.
Can you hear me?
Yeah, I can.
Okay, perfect.
Let me try to share the screen. What do you see right now? Just empty? Black screen?
I see your face.
Yeah. Uh,
Good afternoon. My name is Julia from the Customer Success Team at MetroPlusHealth. Could you please give me a call back at 212?
all right. Do you see the PowerPoint?
Again, my name is Julia.
Hold on.
9 a.m. to 5 p.m.
Yes.
Have a great day.
But it's not in the presentation mode, right?
No, it's not.
Okay. What about now?
Yes, it is.
Okay. Click. And you only see the presentation, right? Nothing else.
I see your, I mean, yeah, no, I see like
Mhm.
the speaker side, but that's it.
Okay. Mm. Oh, I do remember what I need from you. So apparently if someone typed the questions on the chat, I cannot see it.
Okay.
So do you mind just to send it to me by Teams?
Yeah, are you going to be able to look at Teams
Yeah.
and have up your screen?
No, I'll look at the Teams from my phone.
Oh, okay.
Okay.
Yes.
Who's setting up tomorrow?
So you see the slides are changing, right? I'm changing from one slide to another slide.
But the tent and everything, who's helping us?
We have a tent?
Sorry.
No, right?
Yeah, I see Alzheimer's disease in the brain.
Okay. Okay, let me just try the
They never
video.
talked to me about it. They never spoke to me about it.
She mentioned that in the meeting because it's outside.
We don't have a tent.
Holy cow.
Yeah. Good afternoon. My name is Julia from the Customer Success Team. Please give me a call back at 212 908. I'm available Monday to Friday from 9 a.m. to 5 p.m. Thank you and have a great day. Bye. Yeah, because they arranged something stuff 2 days ago. Okay.
Mhm. Okay.
Did you see your phone? Did your phone go off with my text
Yeah.
to the whole team? Okay.
Yeah. Mhm. Um,
Where the heck are my headphones?
how do I blur my background?
Um,
Blur my background. Okay, got it. I'm ready.
do you want to blur or do you want to do the whole
No, just blur.
background?
Just blur. Alrighty, just waiting for Mary.
Good afternoon. My name is Julia.
Did you ping her or message her
Yeah, I'll
to
remind
log
her.
on early?
Yeah.
Okay.
Yeah, I
Good.
told her. Yeah, I told her like yesterday to
Okay,
log
great.
in like
I'm gonna.
15 minutes before.
Okay. Do you want me to mute? I'll just mute myself, but feel free to talk to me.
Yeah, yeah. Thank you.
No problem.
about the London's, that London time, maybe this one, use some parts of their shoe. Can we just like table with the, often the things we bring in?
Yeah, we can table. Well, your problem, your problem. That is gonna be hard.
All right, James, take care. The opposite shape.
You have no idea.
Right. Not comprehending a lot, to be sure to be right. What's one thing I feel like they were supposed to, we needed to say. That's just going on.
Housing Expo.
Hello, good afternoon, everyone. Welcome to the webinar. We're still waiting for Mary Madden. She's a bit late, but she'll be here soon. Hi, Mary.
Hey,
How are you doing?
Good. Can you hear me?
Yeah, I can hear you well.
Okay,
You can
good.
hear me? You can see everything well?
Yeah, thank you.
Alrighty. So, do you see the presentation?
I see I see the MetroPlusHealth.
Yeah, the first slide.
I see the first two.
Okay, awesome. So very good. And yeah, Mary Catherine Madden. Just to make sure I have your name
Yeah.
correct. Alrighty. So we'll start maybe in like 2-3 minutes.
Okay, I'm ready.
Just waiting for people to joining in just a little bit. All right.
You see? So who attends these talks?
I'm sorry.
Who attends these talks?
This is for public.
Okay.
So we open most likely coming from MetroPlus, HNH, but yeah, we share the link to public. So everyone can join this Zoom webinar.
And I know you set an hour aside, but does it always go with the hour?
No, it doesn't have to be a long full hour.
Okay.
But yeah, usually it depends on like how long is the slides.
And
But
then
if
are you gonna advance the slides or am I gonna advance the slides?
oh, I'm going to share the slides, so you let me know when to go to the next slide.
Okay.
And we have some folks in here already. Welcome everyone. We'll just give like maybe 1 more minute to start. All right, we're going to start. Good afternoon, everyone. My name is Angie, and I would like to welcome you to our webinar today on this beautiful summer day. And first of all, I'd like to thank our Chief Marketing and Brand Officer, Laura Santilla-Sacone, Elmhurst Hospital, MetroPlusHealth Brand Experience Team, and certainly our special guest speaker today, Mary Catherine Madden. So a brief introduction about Mary Madden. She is the nurse practitioner at Elmhurst Hospital. Over the years, she has enjoyed providing education service on varied topics to our employees and the community. And today, I am again really grateful for her time for this webinar, which we are going to get information about covering memory loss and cognitive impairments. I please respectfully ask everyone to be on mute. And if you have any questions, feel free to type it in chat or ask it directly at the end of this presentation. So without further ado, I'll give the floor to Mary Catherine Madden.
Hi, everyone. Thank you for coming. Today we're going to talk about memory loss. a lot of times, when people think about dementia or memory issues, they think only about Alzheimer's, but really, memory loss and memory health is a very broad topic. And so we're just going to touch a little bit today on different parts of how to, what are signs of memory loss and what kind of things can be done to address memory loss. So our brain has different cognitive domains, and they do different things, and each part of the brain has different functions. So executive function takes place in the frontal and is the hemispheric white matter of the brain. So when we think about executive function, we think about, I'm going to make a doctor's appointment. I'm going to take a class in school. I'm going to get my homework done. I'm going to pay my bills, right? These are executive functions. And so sometimes when people are starting to have some memory issues, sometimes that can be a sign of that a person is struggling a little bit when we start to see memory functions change. Somebody's not on mute. And then memory, just memories, how to recall memories. That is a different part of the brain called the medial temporal lobe or the hippocampus. And then language comes from the left hemisphere usually. And visuospatial comes from the occipital and parietal, which are sort of the back and the sides of our brain. Next slide. And so what is dementia? Dementia is an impairment in intellectual function facing more than one cognitive domain. So this interferes with social or occupational function. It can be a decline from a previous level, and it is not explained by delirium or major psychiatric illness. So, so when we talk, thank you. When we talk about impairs in functional intellectual function, earlier when we were talking about different parts of the brain, when people start to experience memory issues or dementia, it all depends on what part of the brain is being affected. So not everybody can't remember where their car is parked, or not everybody can't remember their house address, or maybe people are losing the names of something, right? Like, what is that? They can't think of like, oh, what is that I want? I want the cup. They can't think of what the name of the cup is. So all these different things that people experience vary from person to person, and it depends on what part of the brain is being affected. Next slide. So mild cognitive impairment is something that many people first recognize something in a loved one or a coworker. And the cognitive decline can be abnormal for age and education, but does not necessarily interfere with function and activities. So an at-risk state is to develop a degenerative dementia. And when memory loss predominates, it can be like amnesiac mild cognitive function. This has less than 15% a year of does mild cognitive impairment convert to Alzheimer's disease. So that means that 85% of people who are having some kind of mild cognitive function issues are not going to develop Alzheimer's, but they are still having difficulties. And that's why today's talk is really just about a broad memory discussion. Next slide. So here we have cognitive decline as our central focus, and we are going to see all the different things that can impact cognitive decline. So on the left-hand side, you see general medical issues, right? Does somebody have liver problems? Are they having renal problems? Are they having a thyroid problem? Are they being exposed to some kind of toxin like lead in the water or from old lead water pipes? Or are they deficient in B12? Are they being exposed to something in their workplace? Then you can have depression and other psychiatric illnesses, right? when people are alone, when people are isolated, they can have breakdowns in their mental health functioning, and then they can have mild cognitive decline or impairment. Delirium, there's many causes of delirium, right? You can have a fever, you can have a reaction to you can have an illness, you could be in an ICU and not being exposed to the sun rising and setting and not know what time of day it is. And it takes a very short period of time for a frail person in a sick situation to have delirium. So there's just many situations that delirium can happen. Drug induced, right? We can have medications that where people are over medicated. So for instance, somebody can have Parkinson's disease. And if their Parkinson's medication is too much, they can have cognitive decline related to being over medicated. Alcohol, cannabis is now everywhere. And people who are naive to these medications before and are exposed to them, they and maybe they're susceptible to some cognitive changes. Now they're having a mind altering drug and they could have a reaction to it that they weren't anticipating. Dementia, so there's 4 kinds of main dementias, which is Alzheimer's, vascular dementia, Lewy body, and frontotemporal. So while there are 4 types of things, my primary focus for today is going to be on just general memory issues, and we're going to talk about Alzheimer's and vascular. And then there can be cognitive decline related to general neurologic disorders, and that can be trauma, tumor, multiple sclerosis, HIV, syphilis, renal failure, vasculitis, subdural hematomas. So these are all different illnesses from a wide variety of things, but they can all be related to general neurologic disorders that can cause cognitive decline. Next slide, please. So when we look at the percentage of types of dementia, while Alzheimer's disease has a big slice of the pie here, there is other types of, these are the other slices of the pie are the other types of dementia disorders. And so some of these other types we can do some things about, where Alzheimer's may be more limited on what we can do. Next slide. So what are Alzheimer's risk factors? They are age, if somebody already has mild cognitive impairment, if they have a first-degree relative, especially if they had an earlier, younger onset, if there's a vascular risk, and women are more at risk for Alzheimer's than men are. Next slide. The other reason that risks for Alzheimer's are low education. There's some evidence that shows that formal education like high school and college may reduce a person's risk of developing Alzheimer's. It doesn't necessarily, and what they're really talking about is, the mind and the brain as something that needs to be flexed and exercised. So, you don't necessarily have to have had, a high school education, or college education, but if you have a role or a training in maybe a plumber or a carpenter, where you're problem solving, where you have a job, where you're problem solving and you're solving problems, you are addressing complex thought processes, you're setting up plans, things that where we are using our brain function, and then social interaction. So maintaining strong social connections, keeping mentally active as we age might lower the risk of cognitive decline and Alzheimer's. Next slide. So Alzheimer's disease in the brain, these are just 2 pictures, diagrams, and this is mild to moderate on the left, and this is severe on the right. So again, this is description of things that they see in the brain. Unfortunately, sometimes some of these things are after people die that they do brain analysis of to try to understand what's actually happening. And you know, but there are actual changes in the structure of brain tissue related to Alzheimer's disease. Next slide. So what are the clinical features of Alzheimer's disease? The earliest cognitive symptoms are usually poor short-term memory and loss of orientation. I think one of the number one things that people will talk about is like they don't remember where their car is parked. And that's often a very common thing, or maybe they, you know, for us that live in a city and we're using public transportation, they don't remember where their stop is, right? They pass their stop, or maybe they're going someplace and they're not sure where they're going, right? If they're going home, they know where they're going. But if they're going someplace, maybe they're going to a doctor's appointment or a movie, you know, or a friend's house, and they get turned around. Usual slow mental decline is slow. You know, it's not there's not a lot of drama that goes on, and that's why for families, you know, things progress in a people don't go down like this. They go down and they have little plateaus, and they go down and they have little plateaus. And so when you have families and caregivers, the caregivers, you know, we always talk about caregiving burden, right? If I was to tell you, if I was to tell a family member who's dealing with a person who is caring for somebody that has advanced dementia, and if I was to say to them, you're going to carry this huge burden. You're going to do all the grocery shopping. You're going to pay all the bills. You're going to run the house. Your loved one's not going to drive anymore. You're going to be responsible for their medication. If I told somebody that's dealing with a family member that has severe Alzheimer's disease, all the things that they were going to do before it ever started, they would say, I could never do that. I couldn't do it. But what happens is that cognitive decline happens slowly over time. And the burden on the family member piles up, and you're just adding one responsibility after another after time. And the next thing is that the caregiver is holding this unbearable amount of responsibility. And that's why caregivers are at risk for high blood pressure, heart attack, stress-related illness, depression, and oftentimes, you know, will get their own terrible illnesses because they don't have the opportunity for self-care. So, you know, cognitive illnesses are a family disorder, and they're a big responsibility for us as a community and societies. Next slide. So what are some of the behavioral and psychiatric signs of Alzheimer's disease? So we have depression and anxiety. And again, you know, it's not that the person, it's not, they're sort of go hand in hand, right? People that are depressed can isolate and become less social. They may fall away from activities that maybe would keep their brains active. But secondly, if they're having some mild cognitive impairment, they can become embarrassed, and then they can isolate themselves, or maybe they feel ashamed or insecure in participating, maybe at the senior center that they used to go to, or maybe at their job. You know, maybe they're starting to recognize that like some things are going on. People can become irritable, hostile, right? They can, you know, don't tell me what to do. Don't remind me. You know, what do you mean I can't drive my car, right? All of these things, delusions, hallucinations. Again, not only with Alzheimer's, but with other illnesses like Parkinson's disease. You know, medications can affect how people mental health functions. And so sleep-wake changes, again, not getting enough rest can be difficult for family members as well as for the person who is having Alzheimer's disease. Sundowning, I don't know if people know what sundowning is, but that is a type of confusion or agitation that happens at the end of the day. So sometimes people are kind of doing okay during the day, but as the end of the day approaches, they can become irritable, and behaviors can get worse. So, and then there's agitation. Next slide. So vascular dementia. Vascular dementia is a different type of dementia. And it can be, we suspect vascular dementia when there's been an abrupt onset or a stepwise decline. So it means like, there's been an event, mom or dad isn't the same as they were, your brother, sister, your coworker, like something has happened. It can have a fluctuating course, which means that like, maybe you are, maybe somebody is like, they're used to doing a particular task and then sometimes they have difficulty with it, right? Maybe it could be the remote control for the TV. It could be logging into their email. You could have a loved one who, they're using email all the time. All of a sudden they sit down one day to their laptop or whatever, and they're looking and they're like, I'm not sure how to turn this on. I'm not sure how to log in. Somebody can have a stroke, or they can have neurological signs and symptoms, right? Signs of a stroke are paralysis, a drooping mouth, blurry vision, weakness on one side. If somebody has that, that's an emergency. Some of the vascular dementia things are often associated with executive dysfunction, such as a gait disorder, apathy, meaning like not participating, and incontinence of urine or stool. Next slide. So again, we come back to the cognitive decline. So there's so many causes, so many things, but the thing is that there are some things that we can't do anything about, and there are some things that we can do something about. We're going to talk about that now. Next slide. So what is happening? What is the patient really experiencing? What is the family and loved ones experiencing? If somebody repeats themselves, they forget things, there's a change in personality, judgment, behavior. Associated symptoms can be headache, trouble with vision, speech, strength, coordination, and gait. Next slide. And again, what is happening? What life skills are affected? Are they executive function, appointments, dates, times, trouble planning, trouble finding words, trouble with appliances, navigation problems, hallucinations? Next slide. So how is the life function affected? And again, who's paying the bills, who's doing the laundry? Can the person, maybe they used to go bowling or play golf, or have some mahjong group, or play cards with a group, and all of a sudden now they're not able to be functioning in their part of the group dynamics. Driving is a big thing that families have to deal with. It's a very strong sense of our independence, is being able to drive a car or get around independently. And that is something that many families that are dealing with cognitive function changes and dementia have to deal with. And some people lose their ability to work, and their social circles can get contracted. Next slide. So we have to figure out what's going on when people have these things. So we want to fill out the picture, right? We can't just say, oh, somebody's losing their mind, oh, somebody's getting dementia, because many times there are illnesses that can be treated. So the first goal is to exclude readily treatable causes. Next slide. So possible treatable causes of dementia are like a subdural bleed. So that can happen when like somebody could fall, hit their head in the shower, and they can have a bleed in their head. That's why it's very important to come to the hospital if an older person has fallen, especially if they're on blood thinners, to get blood tests for thyroid disease and B12. Untreated sleep apnea is a huge thing. And with so many people having obesity issues, untreated sleep apnea is a huge cause of cardiovascular disease as well as memory issues. Depression and anxiety, alcoholism, we, the alcohol companies, they were the ones behind, trying to say that like a little bit of alcohol is okay. And a lot of cultures, socialize around alcohol. But how many units of alcohol are really safe for people, is becoming scrutinized more and more. And so, they used to say 2 drinks a day for women, 3 drinks a day for men. That's probably way too much alcohol. It's probably way too much alcohol. There really probably is not any health benefits to drinking alcohol. That's probably what we're determining more and more. And that doesn't mean that people can't have a social drink, but how much are people drinking? How much is really safe? And then as a person gets older, how much benefit, the social lubrication of having a drink versus what are the negativities? And a lot of times, when we're talking about trying to preserve our minds into our later years, we have to think about what are we doing in our young years, right? Our early years, our middle years, when we're working, when we're going out socially or with work, how much alcohol is being drunk, and it's not, when we have a problem when we're 75, it didn't happen in the last 3 months. It happened over the last 45 years. So, it's not one drink, it's how many drinks over how many years, and then was there a benefit or a negative outcome to drinking too much alcohol, and how much alcohol really is good for us. That opinion is changing over time. Medications such as benzodiazepine and opioids, as well as anticholinergic medications, which are different types of antidepressants, bladder medications for people that have urinary incontinence, and Benadryl, and then neuroleptics, medications that people take for seizures, and dopaminergic, which is medications that people take for Parkinson's disease. Next slide. Is that my last slide? Okay. So when somebody has signs and symptoms of changes in mental capacity, there's a general neurologic exam to look for any kind of neurologic disorder that might be happening. And then there's cognitive screening. There's called a mini mental exam, a mini cognitive exam, and the Montreal Cognitive Assessment. And all of these are just versions of each other. They look for different things, and they're able to help guide the providers as to what could possibly be going on with the patient or a loved one. Next slide. So are there reasons to diagnose dementia? Absolutely, there are reasons to diagnose dementia. Sometimes families who had an older family member that had dementia, and then they start to experience another family member that has dementia, they feel a little hopeless. They feel like they know what they're dealing with. Maybe the person that it's happening to is resistant to going to the doctor or going to the healthcare provider, but there may be very treatable causes to cognitive changes, and the sooner the better. So some degenerative dementias do have symptomatic pharmacotherapies. Patients and families who know and understand what they're dealing with, it can help with long-term planning. It can facilitate research efforts and facilitates advocacy and group support. Again, like I said, this cognitive illnesses are a very long disorder. People do not die quickly from these things, and the burden on the family is huge. So anything that can be done to ameliorate how fast it's happening, what's happening, how to plan for long-term care, and also keeping the person functioning at the highest level possible. And also, that maybe things could be treated. You know, like somebody could be having cognitive problems because they're on a medication that's not agreeing with them, and just taking that medication away or lowering the dose might ameliorate those problems. So very important to make sure that we're dealing with the treatable cause. Next slide. And what about drug treatment? There is no current drug treatment that slows down the neural loss in the brain. Research is ongoing. Available medications have limited benefits. The cholinesterase inhibitors have modest symptom improvement in Alzheimer's disease. That's like donepezil, which is you know, these medications have been around for a long time. And Aricept, donepezil is Aricept. Many people might know that name, but they have modest help. And then memantine has a modest benefit in conjunction with these other medications. And sometimes memantine can help with sundowning. So next slide. Thank you very much. And I think one other thing that I missed over talking about, I was high blood pressure. So vascular dementia can be caused by high blood pressure, because these one second. Sorry, my screen froze out. So the high blood pressure is one of the reasons that all people should make sure that their blood pressure is controlled, is that the tension of the high blood pressure on the vasculature of your brain can be one of the reasons why people can have, at the, you know, after years and years of dealing with high blood pressure, that you can have vascular changes. So it's another reason to have a good primary care provider and manage your blood pressure and stay on top of things, because it's really about self-care over the course of our lifetime that can help minimize cognitive function changes later on in life. So thank you very much. Does anybody have any questions?
Yeah, well, thank you very much for sharing the information about memory loss. One point that was really interesting for me is like, make sure that we are socially active as we age, because it can prevent a memory loss. And now we have the time for Q&A. There is someone asking in the chat. So this is regarding the alcohol. This is really interesting. So the person asking, I heard red wine is good for you. Is that true or not?
So so I would say that resveratrol, I'm not going to say that right. So there's a component to red grapes that was supposed to be associated with antioxidants and helping with overall cardiac health. And so then the wine companies took that on to say that, like, oh, red wine is good for you. But the amount of red wine that you would have to drink in order to have the benefit of that component of the red wine would be a lot of red wine. And I think more what it is that people people who drink red wine are also from Mediterranean countries. So Greeks and Italians, and they eat a more Mediterranean diet, which has healthy fats, fish, less red meat, less fatty foods, well-balanced diet, more whole grains and fruits and vegetables. And so the Mediterranean diet is shown to definitely have heart health benefits and also mental health benefits, maintaining cognitive function. So I think that the wine companies extrapolated that the countries that focused on eating in the Mediterranean diet also drank wine, and they were like, oh, so it's healthy for you. So
perhaps it can be healthy in a certain portion, and also if we are doing the right diet, right?
yeah, so that's the whole thing, is that can you have a little bit of wine? Absolutely. But should you be drinking wine because you think it's going to give you heart health, or that it's going to lower your blood pressure, or it's going to protect your brain? No.
Got it. That's awesome. And we have another questions. How can you tell the difference between memory loss and ADD?
Wait, you're not talking about.
So, sometimes, so Alzheimer's disease has a different pattern of memory changes than just moderate cognitive decline. Sometimes they overlap, but for instance, if somebody was having moderate cognitive impairment, they might be, they would know who you know, let's say within their family. They know who you are, they know your name, they know your birthdays, you know, they know the neighbors. They're familiar with their neighborhood, they can, you know, get around their house, let's say, right? But then they go to, they sit down to watch TV, and they might pick up the cordless phone and point the phone at the TV. And be like, oh, you know, so they're confusing the phone with the remote control, right? So they haven't lost any like real function in the house as far as like memory of who people are, but in that moment there was like a little gap there, right? So that's like an executive function. So a little executive function was lost there in that moment. Somebody with Alzheimer's disease, they might repeat themselves. Did I have breakfast? Did I have breakfast? When are you gonna have breakfast? When are you gonna have breakfast? They might focus on, I need to go to the bathroom. This is something that happens quite often, is that they focus on bowel function and they will over medicate, excuse me, on they will over medicate on laxatives because they don't remember that they went to the bathroom. And they're very focused on wanting to go to the bathroom. They'll give themselves laxative and they'll get diarrhea. So that's something that like families function and have to deal with. Let me think of some other examples. Sometimes mild cognitive function can sort of come and go, you know, like the like that example I gave you about like logging into an email or using the telephone, you know, that could kind of come and go. But with Alzheimer's, once it's sort of lost, it doesn't come back. And then with mild cognitive function, they tend to hold on to, you know, the family relationships of who people are. But with Alzheimer's, sometimes that goes away and doesn't come back. Like for instance, many of you may have heard that you know, they remembered things that are far away. So for instance, their adult child might look like what their sibling looked like when they were younger. So they may start talking to their adult child as if they were their sibling when they were younger. You know, that like the person with Alzheimer's sibling, things like that. Any other questions?
We do, but before I read the questions from the chat, is there anyone maybe want to ask the question directly to Mary? You can unmute yourself. All right, then I'll continue reading from the chat. Another question is, how can one, okay, sorry. If someone is having serious memory decline, what resources are recommended?
Well, the first thing would be to, you know, go to your primary care doctor and to be evaluated to see what's going on. And that evaluation, you know, would be a thorough exam that includes you know, blood tests, evaluation of what medication somebody is on, what social habits they're having, you know, are they drinking too much? Are they smoking marijuana? Things like that. And then also being evaluated for other medical problems, right? Like high blood pressure, depression. You know, if somebody is already diagnosed with depression, you know, are they, you know, maybe they're getting older, maybe their weight's changed, maybe their social situations changed, you know, so it can be a lot of different things, but the first thing is to really have a complete workup with a primary care doctor and then a referral to a neurologist or something if any other issues are brought up.
Got it. Another question. How can one distinguish between normal age-related memory changes and more serious memory issues?
I would say that cognitive decline is not normal. So I would say that you know, people should not think that that memory problems are a part of getting older. That's not necessarily true. And but there's many things that we can do when we're younger, such as exercise and controlling our blood pressure. Everybody should be walking a minimum of 30 minutes a day. A minimum of 30 minutes a day, out and about in the sunshine, walking 30 minutes a day. And I don't want to hear that you don't have time. It's park a little further away, go out at lunchtime, get out of the train a couple of stations earlier and walk 2 stations to get to your job instead of taking the train right to your job. But the upside to just walking and getting some vitamin D from the sun exposure is very important.
Yeah, I guess walking out and also try to socialize, right? Because when we are actively socialize, it can
Yeah.
prevent the memory loss.
Hobbies are very important.
Mm,
Hobbies are very important. We get very caught up in these addictive things that we carry around with us. I mean, 30 years ago, if you would have told the entire population of the world, we're going to make you carry a 3-inch by 6-inch little square around, and it'll track you wherever you go, and you'll be looking at it all day long, and you won't go out and you won't go to the park because you'll be staring at this little electronic box. People will say, I'm never going to carry it. Oh, and we're going to make you pay for it. We're going to make you pay for it.
and keep buying the new version of it.
That's right. That's right. So, we do have to put the phone in the bag, get outside, walk around, and
In the corner.
Totally. So we do have more questions. People are getting excited about this. The next one I have is, how can family members or caregivers assist in the diagnostic process?
That's definitely very important. And, first of all, we're afraid, right? Like, I don't want that to be happening to my mom, my dad, my partner, my husband, my wife, my child, right? I don't want that to be happening, right? So we can make excuses for why not to follow up. But maybe we're afraid of the stigma that's going to happen. Maybe we're afraid of somebody having to lose their job, or there's just so many things. There's just so many things. Can you just hold on one second? Sorry, there's another clinic going on here and the label printer's in my room.
Totally fine. But do you still have time for more questions?
Yes, I have.
Okay. Yes.
Uh,
And yeah,
so what were we saying? Oh, we were talking about, so how do,
assist from family members or the caregiver.
yeah, so here's the thing is that, we can recognize that something's going on, but that's a very hard talk to have, either with ourselves, if we think something's happening with us, or with our loved ones. And so you have to be the courageous one, advocate, figure out a gentle way to talk to your loved one. And, and if you don't have a primary care provider, to just sort of like, get a primary care, get the things in place for you to help your loved one get to a provider.
And this is also the question from Rhea-san. Are there any specific activities or brain exercises recommended to enhance memory?
So there are, and they can be a variety of different things. But you know, they do talk about puzzles, they talk about games, reading. I would say that all of it's true. You know, if you're you know, all of these are good habits for us to develop. You know, when we are in our working years, it's very hard to undo. It's very hard to undo cognitive decline, but we can do a lot of things to maintain our cognition, right? And so, you know, exercise, you know, when we go for those walks, you know, there's something called perceived level of exertion, right? And that perceived level of exertion is how we get our heart rate up, how much blood is going to flow through our brains, right? And so you want to have a perceived level of exertion where when you're walking, it's not that easy to talk the way I'm talking now. So I want to say, well, when I'm finished walking here, I'm going to make dinner, okay? That's a perceived level of exertion of about a 7. So if you're walking, you should want to intermittently push yourself a little bit. That will get you into that perceived level of exertion so that you're actually trying to obtain some fitness. And then the other thing is just to have good habits, you know. Those habits include, you know, doing a puzzle and also doing puzzles with friends. Like my sister and my 2 cousins, we do Wordle in the morning and then we share it with each other, right? So you do things that are like fun. My mother-in-law is 94 years old and she does word circles and crossword puzzles and she reads. This woman is plowing through books, you know. I mean, unfortunately, she has bad osteoporosis, and so she dropped her puzzle book on the floor last year and broke 2 ribs bending over to pick it up, you know. But her mind is sharper than everybody on this WebEx. So, and she's always been a puzzler, and she's you know, so yeah, it really is about, and she goes to a senior center and she belonged to groups. She volunteered, you know, there's lots of ways, you know, a lot of us think, oh, I can't do this, I can't do that. But, you know, it does take that initial step, you know, to connect with other people. And it's not difficult. It's not difficult. You just have to make that step.
Correct. I totally agree. And the puzzle thing, I heard that many times. Try to be puzzle, read books.
Yeah.
Like solving problems, even like as small as like regardless how small the problem is, it like helps.
Yeah. I mean, you know, there's not a lot of benefits to sitting on the couch and watching TV. There's just not. You know, it's fine for a little bit, you know. We all have the things that we like to watch, but at the end of the day, you know, you would be better off, you know, like if you're gonna watch Jeopardy, you better be trying to answer those questions.
Still use your brain when watching it.
That's right.
So speaking about like solving problems, there is this one question, pretty interesting. Can work burnt out lead to Alzheimer's or other serious memory issues? Especially for us, you know, right? We work every day so hard. Can it somehow lead to Alzheimer's?
I think that burnout can lead to anxiety and depression. Burnout can lead to high blood pressure. Burnout can lead to feelings of being overwhelmed. And, you know, in the same way that, you know, I was talking about the caregiver, right? If I told the caregiver, here's a list of all of the things that you're going to be doing. If I told you that at the beginning, you would say, no, I can't do that, right? And that's what burnout is, right? Burnout is that you're in a position where you slowly are accumulating so many tasks for whatever reason. And some of it's that, these burnout can happen for a lot of different reasons, right? Burnout can happen because you're in a high stress job and you're not afforded to or doing enough self-care. It can be because you're in a job too long, right? You're in a high stress job for too long. Like I had a new college graduate, and she took a position in where she was helping with foster kids who were visiting parents and the court system, and it was a very sad, complicated job. And when she came to me after she graduated college and she said she was going to take this position, I said, that's a very honorable and wonderful thing that you're going to be doing, but I want you to have an exit plan, because that's not the kind of job that you can do for 20 years, right? That's the kind of job that you can do for like 3 years. And then you have to see, where do you want your career to be? And she did it for 4 years, but by the time she was coming to the end of the 4th year, I happened to meet up with her, and she said to me, I didn't really listen to you when you were telling me what you're telling me. And now I'm at this point where I'm desperate to get out of it. I'm desperate to get out of it. And so, there are jobs, when I was younger, I worked in an ICU, and, I enjoyed it when I was there, but I don't want to work in an ICU now. And then, I had someone, again, who became a nurse a little later in life. And, she told me she was going to take this job in this, she had been a pediatric, she worked in a peds area, but then she became a registered professional nurse. So her first job after becoming a registered professional nurse, that she tells me, she was about like in her late 40s, and she said, "Oh, I'm gonna take a job in a pediatric ICU." And I said, that's not the job for you. And she said, "Why?" And I said, "You're too old for that job." And she got all insulted. She said, "Why? What do you mean I'm too old for that job?" And I said, "Well," I said, "your preceptor is going to be 24, and she's going to be teaching you about pumps and ventilators and this and that." And I said, "That's a lot to take on at like 47. I said, "So, I think your first job as a nurse should be less stressful than that, So she didn't take nobody ever takes my advice. But anyway, she didn't take my advice, and she took that job. And then I met her about 8 months later, and I said, "Oh, how's that going?" And she said, "Oh, I left there." And I said, "What happened?" And she said, "Well, you were right about everything, except she was 22 instead of 24. So, we have to, again, it comes back to self-care, right? Burnout is, sometimes we don't have any control over it. Sometimes we don't ask for enough help in the workplace. If you're in a job where you make all the work go away, but you're burned out, it's because you're not letting the people above you know that you have too much on your plate. And so, if the work disappears, the manager's job is being, that if you make the work go away, you're not showing anybody that you're burnt out.
Gotcha.
But also there's a time and a place to move on. And there's a time, if you let the people that you work with know that, so burnout has a lot of different, functions. I gave a few examples, but some of it is situational, right? You just happen to work in a busy, stressful area, or the particular role, like I described, that first person. And, there's only a certain amount of time that you can work in that. I worked in an ICU. There's only a certain amount of time that for me that I could work in that, after it became, that grind that I was thrilled for the experience that I had. I enjoyed it professionally, but I was ready to move on. And the same thing is, don't put yourself, the other example I gave, don't put yourself in a situation that's stressful, putting unnecessary stress on yourself. A lot of it has to do with self-care. But yes, burnout can cause depression, and then, high blood pressure, and that can lead to cognitive changes.
Got it. So again, if anyone in here feels too burnout, self-care first. Take care of yourself first. And one last question. Reyes, I just realized this is from Angel. This is pretty good. How can someone with memory loss maintain their independence? At what point is it suitable to consider an option like placing a loved one in a nursing home?
That is a very, very, very difficult question, and it really is depend. So first of all, most people don't have the option of placing somebody. Current, you know, um, uh, if you, it's a very complicated situation. We do not have national health care that provides, inpatient nursing home care for people with dementia unless you have, as a rule, So Medicare, which is the health insurance that elderly, if you're over 65 and getting Social Security, you have Medicare, and Medicare does not provide long-term health insurance. And most people that got in the business of long-term health insurance are not in that business anymore because the policies that they sold in the 80s and 90s are people lived longer and many more people had dementia, so they're having difficulty supporting those things, those kinds of policies. It's very, 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 very complicated. You can have a young person who is having dementia, and that's one situation. You can have an elderly person that's having dementia. That could be another situation. I know a story recently of somebody that is only 61 and was affected by the work that he did at 9/11 at the World Trade Center, and he has very bad cognitive loss. And he has an early onset dementia, and it's a lot for the family. It's a lot. So, and financial planning is very difficult because, the person has to go along with it, So, there is no easy answer, but across America, individual families are shouldering the burden of care on people that are having cognitive issues. The bulk of it falls to the family.
I see. This is really interesting, but when we talk about it more, if we think about it happening to our loved ones, it gets difficult. But we have to know about this and we have to prepare.
Yeah.
And I do apologize for anyone else who have questions because of time. We have to move on now. But for anyone in this webinar, if you have any questions, feel free to send it to me. I just send my email in the chat, batuba@metroplus.org, and I'm going to relay your questions to Mary Madden. And thank you so much for your time. Now, please let me show just a 1-minute video of MetroPlus Health Touch in Elmhurst Hospital renovation. All right, and joining us now is the sales supervisor, Teofilo Fox. If you would like to say something.
I want to talk. Hello,
Yeah, we can hear you.
can you hear me?
Yeah.
Even you couldn't hear me in the little reel that we did, but you can hear me now. This is what I sound like. I don't know if you could hear. I couldn't hear it on my end.
Oh, you didn't hear the audio of the
Yeah,
video?
there was no audio.
Oh, my
But
apologize. My
this is the
apologies.
person that's on the video.
So
Um,
let's hear it live then.
Welcome to Metro Plus. No, I got it. I know. Thank you, Mary, for all the great information that you provided. My staff is located in the H lobby and Elmhurst Hospital. We're also in the Peds ER, and we're also in the Women's Pavilion. So any of these issues that family members might be facing, or folks that need insurance, you can come over, have a conversation with you. We can get you those necessary appointments, get you connected to the MetroPlus Health Insurance, and push you forward in terms of your mental health and physical health, and get you connected to the right resources in the hospital. If you have any questions, you can feel free to contact me at this telephone number you see down here, or I'll put my email in the message box. And thank you again, Mary. The information, everything that you said was fantastic, and I really love these seminars and webinars that we've been doing lately.
Awesome. So I think that remarks the ending of our webinar today. Thank you everyone for being here. Thank you, Mary, for your time, for sharing this really great information. Thank you, Theo. I wish you all to enjoy the rest of your day. See you at the next webinar.
Thank you. Have a good one.
Bye.
Bye.